If you are caring for someone with COVID 19 at home, follow this advice to protect yourself and others. Learn what to do when someone has symptoms of COVID 19 or when someone has been diagnosed with a virus. This information also should be followed when caring for people who have tested positive but they are not showing any symptoms, what we call as asymptomatic cases. When you are providing support, help cover the basic needs. Help the person who is sick to follow their doctor's instructions for home care as well as self isolation instructions. For most people, symptoms last few days and the people usually feel better after a week. See if over the counter medicines for fever like paracetamol and other medicines for cold and cough are available because these medicine help the person feel better. Make sure the person who is sick drinks a lot of fluids and rests adequately. Help in arranging for a healthy food at home. Help them with the grocery shopping, filling the prescriptions, and getting other items they may need. Consider having these items delivered through a delivery services if possible. If that is not available or possible, so try to see whether you can request any of neighbors or friends to help them in procuring these items. When these items are delivered to home, make sure that it is kept outside the door and you clean them with the disinfectant wipes or wash with the soap and water, especially the vegetables and fruits before using them. Make sure that you are keeping all the phone numbers handy, especially the information of the doctors or the hospitals that you may have to contact in case of emergency. Monitor the symptoms. So make sure that you are monitoring the emergency symptoms, that you may have to call the doctor or the hospital immediately. Suppose if the patient is developing any difficulty breathing, or if they have any persistent chest pain, if they develop any new confusion, if they're not able to wake up or stay awake, if there are any bluish discoloration of the face or the lips, if the cough is progressively increasing and not coming down, if the patient is developing any continuous diarrhea, fainting, or a profuse sweating. So, these are the symptoms you have to monitor and contact the doctor immediately. So, make sure that the patient is taken to the emergency room. When you are taking care of someone with the COVID 19, make sure that you are protecting yourself and others. You will be in quarantine. Make sure that you are staying home, except for you're going out for medical help. No visiting any public places or attending any religious or social events during this time. Make sure that you are not allowing any visitors to your home.